Our final and terrific speaker is Douglas Luke. He trained in quantitative and community psychology, and he's a professor of social work at the at Washington University in St. Louis, and he currently directs the Center for Public Health System Science there. His work has focused primarily on evaluation, dissemination, and implementation of evidence-based public health practice. And he's a internationally renowned expert in tobacco policy and in social network analysis, among many other things. We're so glad that he's here. Thanks so much for coming.
Thanks, Amy. Thanks, Anna. This is a real privilege to be here. I'm actually not going to talk about network analysis today. I have more experience with that, so I'd probably be more comfortable talking about that. I think what happened is a few years ago, I came up with this idea of a study that we named Tobacco Town, and who knew that that would result in being invited to a symposium on health in cities. What I'd like to, you're going to see a lot of parallels to previous talks, and in particular Magnus' talk that we just heard, because I'm going to be presenting the results of a specific agent-based modeling study. The policy area is different. It's in tobacco control, but you'll see that the opportunities and challenges and excitement about this sort of work is very, very similar. And I'm presenting the work of a big team, and in particular a partnership between our center with a group at the Brookings Institution led by Ross Hammond, who many of you know. The main question here, and something that I've been thinking about for a while, is can we use computational modeling to learn more about the behavioral mechanisms that underlie effective public health policies? And one of the things that I'll probably touch on a few times here is I think these types of modeling approaches are particularly powerful for unpacking the black box of policy effects. We heard earlier about observational studies and randomized clinical trials. RCTs and other traditional designs can tell us whether something works, but they often are silent about how or why something works. And I think this is a particular exciting area for computational modeling approaches. The policy area is tobacco control, and specifically the point of sale area. This is tobacco products remain the most heavily marketed products in the world, and the vast majority of money spent on marketing is at the point of sale. That is where people buy cigarettes and other tobacco products. And one of the areas in point of sale is retailer density. This shows some of the literature that supports the relationship between the density of tobacco retailers in communities and a variety of tobacco health behaviors and outcomes. If you live in neighborhoods with more tobacco retailers, you're more likely to smoke, it's harder to quit, and essentially we've seen this relationship in tobacco as well as alcohol and other areas. So if that relationship is there, it makes sense to think that, well, if we reduce retailer density, all sorts of good things might happen. And I tell my students, and they're surprised to hear this, that a lot of times you can't remember when you first got an idea for a particular study or project. But this is a case where I do remember. And we were at a meeting at CDC, colleagues, Kurt Ribisel in particular, was there with me, and CDC was starting to get more serious about looking at point of sale, and we were talking about retailer density. And the way the conversation went is there's a sense of, okay, if retailer density is high, let's just reduce it. And at each step, we would see some sort of benefit for reducing density. And I remember, I don't know, it wasn't a major epiphany, but it was an aha. And I remember leaning over, I probably hit Kurt on the shoulder, and I remember whispering in his ear, it's not going to be that simple. At the risk of being embarrassed, I sort of want to show you what that epiphany looked like in my head. So this is Shelley. Whoa. giving it away. And Shelley lives in an urban environment, let's say, and when she wants to go buy cigarettes, she just has to go outside her apartment and walk down to the nearest block corner. In fact, there's 3 gas stations and a Walgreens, and it's easy to get cigarettes. Now think about a retailer reduction policy and what has to happen for her to notice that policy. That retailer has to be removed, that retailer, that retailer, that retailer. Finally, she would have to do something different. That is, she'd have to travel further to get her cigarettes. And when I thought about this, I thought, there's going to be threshold effects, or at least some amount of non-linearities. It's not going to be as simple as you remove 10% of the retailer and you're going to get a 10% or a step-by-step concomitant result. And when I thought about that, I thought, this will be a perfect application of modeling, which is the sort of work I had been wanting to get into more. So really, instead of thinking about this sort of relationship that's linear and suggests that as we lower the density, the cost will go up. And here we're using a general concept of cost. Cost is the amount of money, but also the amount of time and the amount of effort it takes to get cigarettes. There's more likely to be some sort of nonlinear relationship. And so Tobacco Town was born from that. So why do we think density reduction might work? Well, there's lots of potential mechanisms, including changing social norms, which if we have time, we can come back to. But the mechanisms that we first started thinking about in terms of our modeling is in particular these top mechanisms. Greg Connolly talks about this in tobacco control. If you make it inconvenient, if you make it harder to get cigarettes, that will have an effect. He had ideas like make every pack of cigarettes like 2 feet by 3 feet big, and so you can only carry one. That would actually work. It would work. And what our model is designed to test is essentially how far do you have to make people go before they'll notice and start changing their behavior. A few of you may remember in the 60s, I'd walk a mile for a camel. We actually don't know how far people would walk or drive for a camel, though I searched this and I found on Reddit somebody said he went 2 miles to get cigarettes when he was out. In point of fact, most people don't want to go that far. They don't even, they want to not have to travel very far, and they don't, of course, want to spend a lot of money if they can avoid it. So this was our first schematic, which is just essentially a cartoon schematic, but it was this general idea that we can use modeling to study the sort of the mechanisms of how these policies might work. This is a lot in one table, but this gives you an outline of what our model looked like. It's it's certainly a simpler model than we just saw. It's fairly abstract, except in certain areas. So we're just looking at adults. They're all smokers. However, they live in 4 different towns, tobacco towns. And we're looking at urban rich, urban poor, suburban rich, suburban poor, based on actual towns. But generic in the sense of the model. The smokers do vary. We have light and heavy smokers. Important for thinking about policies that have physical effects, we wanted to model realistic mixes, transportation mixes. So we have a mix of walking, biking, and driving. And essentially, these people have very boring lives. They get up, they go to work, they use up their cigarettes when they go to work, and they consume them at 2 different time points. But essentially, while they're going to work, they decide whether they need to stop somewhere and buy cigarettes. The most important thing here is because we're looking at retailer policies, we have pretty realistic distributions of retailers by type. And then the most important thing that we're monitoring is our outcome variable, which is not consumption here. Remember, we're trying to unpack how these policies might work. And so here we're actually looking at what is the cost to get cigarettes. And it's a function that our agents are minimizing, but it's essentially how much time, how much money it costs for the transportation during that time, and then the actual purchase cost of cigarettes. This just shows you that the town types actually vary quite a bit. In particular, they vary dramatically in how many retailers are in the town. So, if this works. So this is our low-rent Sim City. And so what you see here is Tobacco Town in action. You don't actually need to have a movie like this, but it really helps in situations like today. And I made Ross and his group do this because I just didn't trust that this was actually working in the computer. I wanted to see it. So here's our abstract grid, 10 square miles. The dots are people going to work. The color is the transportation type. There's jobs, those don't really matter. But the big squares are retailers, colored by type of retailer, and the size of the square is how much the cigarettes cost. And when people, okay, it's getting to the end of the day, everybody's at work. When people are purchasing cigarettes, the dot flashes. And essentially you can see that there is a physical model of transportation and the agents are making decisions about purchasing. And now they're going home. So, okay, that's all set up. Now, what I'd like to go through is what we've been learning from this model. And the exciting thing here, again, is this ability to not only test individual policies, but to test multiple policies. Jose, you talked about policy silos. When we look at policies, we tend to study them one at a time. But actually new policies always enter in real communities like a policy soup. There's lots of other things going on. And we need to have some methods that allow us to look at the interactions of these policies. We tested 4 main semi-realistic interventions. One is just a random reduction of retailers. And communities like San Francisco are doing a cap and winnow policy approach where over time they're just lowering the total number of retailers you can have in a community. So we tested reducing from 10 to 15%. We are already seeing real-world policies like pharmacies deciding not to sell cigarettes. We tested a realistic policy, which is getting rid of drugstores, and at this point in time, an unrealistic policy, getting rid of all convenience stores, which includes gas stations. Obviously not getting rid of the gas stations, just getting rid of them as tobacco retailers. Then there are policies that are buffers around schools, just not allowing sales of cigarettes if they're too close to the school. We looked at 500, 1,000, 1,500 feet. And then a retailer proximity, not allowing retailers to be too close to each other. Finally, we looked at a layering. What would we find out if we combined policies? And I'll say more about that in a little bit. The next set of slides I'm going to go through pretty quickly because they're all sort of parallel. This is just what these towns look like at baseline. So before we do any of the interventions. So we see the 4 town types have quite different densities. They're box plots because we're doing multiple runs of the model. And so you get variability, which is sometimes more important than point estimates, by the way. So knowing the range of outcomes can actually be more informative. And then here's our main outcome variable, which is the total cost to get cigarettes. Here's the first result. It's a little complicated, but essentially what you see is as density of retailers goes down across the 4 town types, we do see a bit of an increase in cost. And in particular, and I'll come back and say more about this, you see the biggest changes in the suburban rich communities. When we do sales bans, reducing drugstores barely nudges the density. You get a huge hit when you get rid of convenience stores. And what we see here is both suburban towns see a big bump up here, but only when you're removing convenience stores. Essentially, removing drugstores it's not a big enough intervention. A very different picture emerges when we look at school buffers. Here the effect is primarily in the urban settings, basically because schools and retailers in urban settings start out closer together. And a very similar finding when we look at retailer proximity. What we're able to see here, well, actually I need to pause on this one. Then when we layer multiple policies, we actually see more dramatic effects. Essentially more than one policy, and this is very similar. You're getting more visible behavioral effects, and in particular when we layer the strongest policies. The problem here is these policies are so strong that most real communities aren't looking at, so for example, proximity, some communities are looking at 500 feet. Our simulation suggests that doesn't have a noticeable effect. 1,000 and 1,500 feet do, but you start running into problems. For example, the tobacco industry believes that if you have buffers greater than 500 feet, all retailers would get removed. That's not true for even New York City, but that's where you start getting pushback. Essentially, the tobacco industry doesn't fight against ineffective policies. And so when they start pushing back, you know you're in the right area. Let me show you two summary slides in conclusion. This aggregates our modeling results across most of our runs, and it shows this first intuition of a threshold or nonlinearity appears to hold. That is, you really have to drive density down quite a bit before you see a big spike in the increase in cost. And that is different across the 4 communities. Urban communities start out so dense with retailers that you can never get it down far enough. And what that leads us to is a story that these policies have different effects in different community types. So the cap and winnow approach is good for suburban because they start with not that many retailers to start with. So if you're removing 50%, you're really getting it lower. In urban settings, the buffers around schools and retailers are more effective because that's a policy that has its biggest effect in densely populated settings. And so essentially this is where we ended with this, is we're learning a lot that policies, that there's no one-size-fits-all. Policies have to sort of fit the needs of a particular community, and that we can use this sort of modeling approach to really examine not just one policy by itself, but what happens when you combine policies. So I can say more about this. I'll stop there and see what questions people have. Let me let me just say one more thing because I've been having some conversations with people about this. If you're really interested in the agent-based modeling piece of this story, there's a new IOM report that just came out that provided guidance to, in particular, FDA on how to use ABMs in policy-relevant work. And it's available. It's only been out a few months, so.
Great, thanks so much. We're going to move over to the side and open it up for questions. Please raise your hand and we'll get started.